Coronavirus disease was an important and as a pandemic spread worldwide with unprecedented consequences. So in March 11, the first COVID-19 cases in Cuba were confirmed, and on November 2021, Cuba reported nearly 1 million COVID-19 cases and over 8,000 deaths. That is why it's so important to characterize the main clinical and imaging findings in COVID-19 convalescent patients. In this case, in this study, we follow up 208 convalescent patients from a tertiary hospital in Havana after 45 days of PCR test negative. So medical questionnaires, physical exams, and high-resolution computer tomography were performed. Also, blood samples were collected, and the associations between the severity of the disease in the acute phase with the persistence of symptoms and with the alterations of the HRCT were analyzed. Also, the correlations between bioparameters, alterations with HRCT abnormalities, and with the degree of severity were determined, as well as their independent effect on the persistence of symptoms. So we had different results. For example, the predominance of individuals were between 41 and 60 years old. The majority of them were female, and the main symptoms that they were presenting was around mental health and respiratory issues. The distribution of patients according to the severity of the clinical presentation was 47% of mild disease and asymptomatic patients in around 38%. The treatment that most of them received was interferon. So, other results that we found was that alterations of the HRCT were detected in more than one-third of the patients studied. Respiratory, cardiovascular, and mental health symptoms were the most frequent, and they were associated with the disease severity. Also, an association was found between cardiovascular symptoms with pulmonary alterations in the HRCT. Troponin T values were higher in patients with HRCT abnormalities, and alterations in hemoglobin glycosylate, troponin T, and glomerular filtration rate were observed in patients with moderate and severe forms of COVID-19. So, the degree of severity of the disease, troponin T, and high sensitivity C-reactive protein were independently related to the persistence of symptoms. We consider that all of this is very important because the persistent alterations in serological biomarkers and HRCT images may indicate ongoing inflammation and potential long-term consequences stemming from the acute phase of the disease. These findings could inform the development of policies related to disease prevention and long-term care for patients recovering from COVID-19.